Okay, what? I don't know. Yeah, can we, want to pass around? Does anybody need copies of the minutes? Liz, do you need?
Good morning, everybody. I hope you guys can hear me.
Good morning.
What else is on there?
Hi, Kayla.
Okay. Excellent. I brought the wrong glasses, so I can't see who's up there.
This is Miss Cookie. I hope you guys can hear me.
We can. Can you hear us okay?
I do.
Great. Okay, we're going to be calling roll call. So do we need a motion to call the meeting to order?
No, we do not.
Hi, Kayla.
Hello. I'm sorry I couldn't make it.
Here's Wayne. Yeah, we've got a. I'm gonna do roll call then, right now, because it's 9 o'clock. I've got my little phone here. Mike Nickel.
Here.
Lillian Eunice.
Somebody else with that stuff too. I got that too.
Carol Rodriguez. Here. Lisa Hartley, present. Sharon Mitchell.
Here.
Okay, am I missing anybody?
Wayne.
Wayne
Wayne Flesh is here.
Flesh is here. Okay, so we're missing Susan, Dan, and Nancy, and Lillian.
Susan's on her way.
Yes, and Susan's on her way, but we do have quorum to move forward and to vote on the minutes. So we have first up on the agenda is the approval of, we've got two sets of minutes. If you remember, we couldn't vote, we didn't have quorum last time. So we're voting first on the January minutes last month. So does everybody have a copy that needs a copy? And do we have a motion to approve? Thank you, Spencer.
So moved. Second.
All in favor?
Hi.
Aye.
All opposed? Okay, the January 26 minutes are approved. And now let's go back to the December of 25 minutes. And we need a motion to approve those as submitted. And you may have noticed there were some corrections, some spelling corrections, that the latest version has those corrections made.
So moved.
Second. Okay, all in favor? Aye. All opposed? Great, we've got December of 2025 approved as well.
I think Greg is a yes.
Okay, I was actually gonna pause and see who's up here and,
I did send him the Pamela's link, so,
okay,
yeah.
okay. Do we want, we've got,
This is my stuff.
yeah, we have time. Do we want to stop and do introductions? Yeah, we've got, before we start our old business, I'm looking up on the screen here. We have our, let's see, St. Louis County Attorney, yeah, Kayla. And hi there, thanks for being here and helping us out. And then, Lisa, or Carol, do you want to?
Well, I noticed Craig and,
There he is, okay.
Craig, introduce yourself to everyone. I don't know if everyone here.
Absolutely. And I apologize. I had that horrible cough and didn't think I thought I was muted there earlier. Yeah, my name is Craig Zumsteg. I am the legislative assistant to St. Louis County Councilwoman Lisa Clancy. Dan Rosenthal invited me to these meetings and I'm happy to join. Sadly, I have to do some other work in the background too, but I'm happy to be here and happy to help as much or as little as you need.
Thank you for being here. I'm Lisa Hotley. I'm the vice chair. Dan is out of town. So according to our bylaws, Dan requested that I serve as, what am I called, the host of the meeting? Actually, I don't know. I'm that thing. And then does everybody want to introduce themselves around the table? Mike, want to start?
Mike Nickel, representing District 6 for the council, Far South County.
Carol Rodriguez, and I represent District 7.
Liz DeLaperouse, and I think I'm at large.
I'm Susan Schaefer's and I represent District 2.
Charlene Hughes, Division Manager of Office of Social and Community Services.
Heidi Keeler, and I'm the county liaison to the commission.
Thank you everyone for being here. I also represent District 3, and I would like to update roll call. Susan Schaefer,
Sorry.
present?
Present.
She's present, okay. So we definitely have a quorum. We're gonna jump right in to.
I'm Sharon, I'm sorry, and I'm Sharon Mitchell. Call me Miss Cookie. I represent the 4th District.
Thank you, Wayne. I forgot the whole screen.
Yeah.
Is Wayne Flesh at-large member?
And we, Kayla,
Yeah.
and anybody else?
Sewer.
Oh, Sue.
Sue Orton's over there.
Yeah.
Sue, you want to say hi? She might be muted.
Wayne, you live in Lisa Clancy's district, I believe.
So do I.
Correct.
Yeah.
Okay, and Sue Orton is representing the Committee on Disability, so Sue often attends our meetings. And we thank her for that. So, all right, if we're good with that, and by the way, jump in, anything I forget or don't do right, please jump in and make those corrections. Starting out number 1 on old business. Senior Fund, do we have any kind of update? We've gotten the reports. Does anybody want to give an update on the Senior Fund? We can talk about the committee of the whole meeting a little bit further down, but does anybody have anything in that whole business that they want to share out? I mean, this was pretty much just reporting on the update from last month. So if anybody has anything new to add, please.
The only thing I have to add is I did kind of contact Catherine Veneer to find out what was going on with the Elder Financial Protection Coalition. And as I suspected, it is kind of dissolved. It's not active right now. And she acted a little frustrated with what was going on, but she did say really positive things about Melissa and that office, and she has inundated them with information on how to create a multidisciplinary group to address financial elder abuse. So I need to follow up with them to see if they are moving that along or not.
Great. Thank you. Anybody else have anything? If not, we will move on to, it was the last piece in that old business number 1 was that we talked about to discuss the senior tax levy at a different date. So we were going to kind of monitor what happened, and the committee of the whole kind of brought everybody into the loop, but there will still be a time if everything goes as planned that we'll want to invite someone to have a whole session maybe to discuss our role in that and how we can support, how we can legally support this process.
Can we just, the people who were there, is there any debrief or thoughts that?
I think it's under new business, yeah. Yes, we'll do that. Look at you. Universal design number 2 under old business. Dan, I mean, you've read here that Dan's been active. Sue Orton, do you have anything to add?
Right now.
Sorry, couldn't hear you.
No, I don't right now. I'm sorry.
Okay, all right. So if there's nothing else on that, Dan, I'm sure will give us an update next month. Number 3, again, this involves Dan, St. Louis County Home Improvement Program. the research funding and workforce development, Dan's been very actively engaged. And he did not send any new developments. So if anybody has anything, please share.
You need to update the roll call again, Lisa.
What's that?
Christine's on.
Oh, okay. And Christine, is she there? Can you hear us, Christine?
Yes.
Okay, great. So Christine Hustedy, is that how I pronounce your name? Hustedy or Husted?
Custody.
Okay. Present?
Yes.
I will add you to the roll call. Thank you. All right, next up is number 4, St. Louis County Elder Financial Protection, which Liz just has already addressed. So we're whizzing through this stuff. Number 5, property tax relief for older adults. Does anybody have an update on circuit breaker legislation beyond last month?
No, and I did go online to the Department of Revenue, and the guidelines are the same as they have been for the last, I don't know how many years. So I don't know if the website hasn't been updated, or if, Susan, do you know? Does
No.
anybody else know?
It might be starting for 2026 taxes, which.
That's what I
be
mean,
next year.
Yeah.
Yeah.
Who can we get that in? Can we get that information? Well, I can go back and look at the legislation and see when the start date is. That would probably be the easiest.
Okay, if we've got nothing else on there, how about number 6? Anybody have an update on the master plan on aging? Since hearing that, let's see, last month we talked that it was sent to the governor for signing.
Yeah, I think it's the iCompass program. No, I think it's the iCompass program. It has them ordered differently for the agenda and the minutes.
We got it.
Wait a minute, so I,
That's
no
what's next.
wonder, but I have separate pages than you guys. I printed out the wrong thing. I apologize. Are we still, all right, we've got all of our updates here. Okay, so number 7 then, should be toward aging ahead updates. Is that where we are? Okay, I apologize. I'm working on last month's agenda, which is why it all sounded so familiar. We're doing this again. Okay, so core and aging ahead updates.
Christine, I'd like to ask if there's any updates on the GrandPad program, and on that research.
Yeah, we just entered, I'm sorry, we're about to wrap up year 2 of the grant that we have with Washington University. It is a 4-year grant. We're almost finished with the recruitment phase, which, to give a little more context on that, the original group of GrandPad owners through the county library, there was a separate study for those individuals. So this is a new group of people. And the goal of this study, in part, is to look at the efficacy of a virtual senior center compared to a bricks and mortar senior center. So we're trying to engage people that have some familiarity with how centers operate and are already somewhat engaged, and then compare outcomes around socialization, nutrition risk, and access to services between the bricks and mortar clients and the virtual clients. We should have some actual data in March. The grant year ends March 31. So we'll have some more like hard numbers to share at that point. But it's 400 clients that are home delivered and 250 congregate clients. So a total of 650 new people.
Anybody have any other questions for Christine?
I do. Could you give us a brief update on Older Americans Act funding and kind of what's going on both at the state level and the federal level? Just
I'd be happy to. Yeah. So Older Americans Act at the federal level, with the budget that was passed recently, there actually was a slight increase to Older American Act dollars nationwide. Missouri won't really see much of that for the 10 area agencies on aging. Everything for us will pretty much remain flat. It was special categories that were increased. So in terms of federal funding, we're good in the sense that nothing was cut. The concern with the state general revenue shortfall is that there's a proposed reduction in senior services growth and development, which is directly to the area agencies on aging. They're proposing a 20% cut statewide, which would have a pretty substantial impact on the number of people we can keep serving. So we continue to see an increase in the need for meals and transportation specifically. And so we wouldn't necessarily, if that cut goes through, the concern is just being able to serve the additional people who need the services. There's also the concerns with general revenue impact more than just aging ahead, as I'm sure you're all aware, but many nonprofits are concerned about it. But specifically for us, it's the Senior Services Growth and Development Fund that we're trying to protect through some advocacy efforts. So if the group is willing and able, I can share some updated advocacy language around that.
How much of your budget comes from that state?
From, we get about $1 million out of general revenue, and then from Senior Services Growth and Development, this year it was around $2 million. Next year it's FY27 is what we're worried about being cut. So
Then how would you see that dovetailing with the master plan funding?
well, I think the challenge with the master plan and some of the recommendations is not all of those recommendations were funded with the goal of service providers helping fulfill those. I don't know how that's going to work if social service providers don't have the capacity and they have reduced funding. So there's, of course, we still want to support it. I think we're trying to be realistic in how we move forward with some of those. And we're fortunate because we work directly with Division of Senior and Disability Services, and they're very understanding of capacity and funding issues. But it's just, the plan itself is pretty broad and there's a lot to it and a lot of recommendations included. And I just don't know how far we're going to get on all of those.
Okay. Thank you for that. Once again, I just want to reiterate how important and the role you play on this commission is, because you are laying to so much data and to so much, I mean, you're the eyes and ears and the feet. So we really appreciate all that you bring to the table, and everybody is thrilled that you're here. Anything else on CORE? Do we have anything? I saw county put out the call for older adults needing tax. That falls under the purview of CORE. So county had that as a social media point to reach out all the partners that were involved in tax services for older adults who qualify. So if you follow county and on social media in any way, feel free to share that, with your group. And I'm sure the districts, I'm sure council persons would be interested in knowing that too, for those that need that inside of their districts. But Susan, for years, that program was solid. And so now
It's still solid. If I'm not mistaken, the schedule has been sent out to all council people, so they are aware of it.
Oh, good.
I can make sure that it is sent to you all as well, so you can share.
Oh, that would be great.
thanks, that'd be great. Okay,
Is there-
anything?
Well, I just wanted to add, as long as we're talking about budget cuts and, I think it's prudent of us to know the impact on CORE with county funding.
Well, I'm gonna just say my division budget is shoestring thin. As far as immediate impact on any of the programs, we're only like 6 weeks into the year, so I'm being very frugal and very diligent in whatever I do, hiring, buying. So I really can't give you, any, yeah, we'll see in a couple of months how it can affect any of the program, but so far, so good.
Are you seeing people still finding you, people that are looking for services? Are you seeing that they're finding you? They're calling and they're emailing?
Yes, people are still seeking services. I'm definitely working on increasing people's awareness, because for a little while, it's kind of been at a lull. So we are seeking additional ways outside of county IT. We're increasing our community engagement and outreach efforts, especially south. I think more people know how to do it, but we're increasing the community engagement and outreach efforts across the board to make sure that is in the forefront.
One question on that. Do you have, and Susan, you might be able to help, do you have kind of a 5 or 10-year graph of where services were 10 years ago, where they were 5 years ago, and where they are now?
I don't. And the data, is kind of all over the place. So pulling it together was probably like pulling teeth. And that's something that I am working on, is centralizing data, so that when I get questions like this, it'll be easy to pull and report.
So that was one of the things that came up at the council meeting was when Jamie mentioned that services had been reduced to older adults. One of the county councilmen said, no, that's not true. Susan came back and said, yes, it has. Yeah. But that was an opinion that I think we need to make sure is addressed.
That's a great item to add. We may want to add more questions, find out the other things we need to know. I know, Jamie, when we talked about what is it we need to know when we're out speaking to people, and that data, core data, is really important as well.
And even if it's just the personnel working in core, I mean, that in and of itself is a strong indicator. So.
Yeah, and the programs, just the number of people served, and like you said, increasing awareness. That's not always easy to measure unless you're actively engaging in research. But otherwise you're relying on anecdotal evidence, and so it'd be great if we had solid evidence-based.
Well, and I think one of the things is, like I said at the council meeting, there used to be 11 neighborhood coordinators just dedicated to South County.
Mm-hmm.
And there were an equal number in North County, plus there was staff in Clayton. And right before I came, they had actually had 3 areas, but they didn't decrease services, they just consolidated. So they split the West County area to North and South. So, just through the years, through budget cuts, Charlie knows more than I do, but I think there's 11 people total. And there's actually, unless it's changed, there's only 3 people providing, like transportation, care calls, all those things. Home care and repair went from a fairly robust program to a not very robust program. Because instead of new staff people, there went to 1. And so, just through all of that, the numbers just dwindled. I mean, at one point, Ford was doing over 15,000 rides a month.
Yeah.
And when I left, they weren't close to 15,000 rides a year. Just because there just wasn't the staffing to do it. So
The staffing doesn't really have a lot to do with transportation. It's the lack of volunteers. We have staff that are reaching out, making connections, setting up rides. But from my understanding from those who are still there, that were there during the pandemic, that really hurt our volunteer base. But thankfully, we have a great volunteer coordinator. And she's boosting that, but it's like for the tax program, I think we have 10 to 15 new volunteers this year. But it's the transportation where we're struggling to get new people. So it's not so much the staff because they are doing what they're supposed to do. We don't have that volunteer base like we did prior to COVID. So that we can continue to do those rides.
That's good. Cookie's good, okay.
Cookie, your hands up?
Yes, good morning. I wanted to ask, as you guys know, I'm always complaining to everyone about the transportation. Is there a possibility, since there is rumors, I'm not even sure that has been verified as of yet, that the Clayton office will be going out to the Northwest Plaza location? Is that possible that we could have satellite areas, which would range, maybe alternating things for the seniors in certain areas where it would be closer for people to get to, since there is such a transportation issue?
So it has not been confirmed that Clayton is moving to St. Anne. That is the rumor. That is the last thing that I heard. As far as satellite offices go, I know for the Department of Human Services, we are looking to coordinate, collaborate, and partner with other agencies in other areas of the county to make sure that we have visibility, albeit pamphlets, one-pagers, or sending a person. So that has a lot to do with my staffing restructure, because my particular division handles the family from 0 to infinity, right? So it makes sense to do a lot of cross-training, which we're gonna begin doing at the beginning probably of the summer. Cross-training so that we can send a representative out in the offices of our community partners so that we can increase visibility, Ms. Cookie. So as far as satellite offices, that's above my pay grade, and that's above the acting director's pay grade. However, we are working on some creative ways to make sure that services are spread as evenly as possible across St. Louis County.
I just thought, like, even for a circuit breaker or anything that has something to do with the seniors is getting out to the crossing like that, it is difficult because when you call to get those kind of transportations, they don't even go out to the crossing. And I was really concerned about that. Seemed like that is one of the main places that Colorado, Metro, or any of them should be able to take people. So, and since it's such a lack of transportation and communication and getting it to the seniors, I just thought, well, in another conversation that I had, the idea just popped. Why can't we have a satellite place maybe once a month that could provide some of this information, and for the seniors to be able to come closer to, if they have to register for something, whatever, I just don't know anymore. I do my best trying to, as you already know, trying to get the stuff out, but it is still a hard thing with the transportation and communication, because they're not tech savvy. I think it'll make it easier though if you had a satellite place. Maybe 1 week you have information on CORE, or have a CORE representative, have someone that has something to do with the circuit breakers another week. I just don't, I can't come up with nothing else but that.
No, it sounds like a great idea. And when you're talking about collaboration when CORE is looking for creative ways to reach out, that may be another way, another avenue. So don't stop complaining because you do remind us, I mean, we're all here to represent different districts. So everybody bringing those concerns to the table is really important. I think another thing we talked about several months ago, looking at our direction from here, is how do we as an older adult commission get an update on sort of the state of the county to know exactly what is going on, not just inside of CORE, but for those that don't know, we were part of the Age-Friendly Initiative, which had an assessment, an interdepartmental assessment, and then an action plan. So transportation and Parks and Rec, everybody had a role in elevating older adults, and it was integrated into their strategic plans. We haven't really been updated. COVID sort of waylaid a lot of things, and then the 5-year plan was completed. So we've talked about it the last couple of years. What do we do from here, and how do we look at what's going on inside, and how can we help support so that we have accurate information? Our Parks and Recs doing, programming for older adults that meets the needs in each district, those kinds of things. So maybe that's something for another meeting that we put, an agenda to start. We used to have speakers from each department chairs that would come in and present to us how we fit in to the mix. And it also served as a way to introduce our commission and our goals to each department. So perhaps we'll.
And Lisa, maybe, because this transportation issue keeps coming up, maybe having some kind of transportation, maybe we need to look at getting that scheduled.
Yes.
And having that dialogue. Because I think to the point with CORE, I mean, our role is really to be liaisons with the county council to let them know where the pressure points are. So where there are pressure points, I think we can be a voice, and we do our annual update in May. And so just something to think about, for us all to think about in terms of, where are the pressure points in the county for older adults? Where do we really need to be turning our attention? And I think Cookie brings up a really good point for that area of the county around Spanish Lake. It's not rich in access to services, and transportation seems to be a big issue.
Well, I think let's talk to Sir Dan, and find out if that works with him, that we could schedule transportation and any other department that we find relevant. And hopefully it would provide CORE with information as well, and look for synergistic approaches, because transportation is tough, it's costly, and the logistics are just so difficult that we need to keep complaining in order to find services for people.
Cookie, a question for you. Is there a park or recreational facility that is easy or commonly used in the Spanish Lake area that we could maybe also ask them to see if they're, because that might be a way that we can kind of help address the transportation.
Do you want, is it a must for it to be in Spanish Lake? I would love that.
But
But
that's what you're advocating.
yeah, I'm saying I would love that, but I want to make it convenient for, everyone, not just Spanish Lake, but the Twillman House would be one. And my other suggestion, since Charlene is kind of heading up that department, maybe, I think, isn't Youth on the Rise closed one day out of the week, or do something where they're not there? where maybe we could use that place, that air, you know?
I mean, I'm definitely open, I mean, it's a community spot, so
Right.
even if it concentrates on youth, we could definitely make arrangements to use that space, if need be. But no, ma'am, we are not closed, we're open 5 days a week.
Well, I don't mean close. I mean, I know they do things off-site hours or something, some sort of, you know, I don't know the whole schedule Youth on the Rise. I'm just trying to think of something that also combines the county and represents the county.
For council, that might be a question for your council person to choose a place that maybe they feel
Redmond might be a good place.
would, you know, there might be some place, like you said, Spanish Lake would be wonderful, but perhaps there is another place that really represents your whole district. And so that may be something. Wayne, do you have your hand up?
I do. I'm sorry. I haven't figured out how to put this hand up there yet, but maybe I need a lesson on that. But I have quite a bit of experience in the past with CORE, and I'm wondering, some of this is coming through and not real clear. Is it possible that we could request a written report, a brief one, half a page or whatever, at future commission meetings on CORE? Is that too much to ask that it be some written statements in an update or whatever we could call it, that it be available so that we can understand it a little bit better and get a little background and get caught up on some things? Is that I'm just requesting that we have the written report in future meetings for the commission from CORE.
You're asking like what kinds of programs, how many people invited, how many people participating? Are those the kinds of questions you have, Wayne?
That sounds good. And then just some of the things in terms of what they're looking for in the future, what they're planning, different aspects of that. Nothing detailed, or don't make it a real big task or anything, but just to bring us up to date and give us a little more information on CORE and how it's functioning. It's just a request to see if it would be helpful to me, and being on the screen here, it would be even more helpful to have that in front of me.
I am willing for you to send questions and then I can answer them. But as far as putting together a comprehensive report, that's not feasible right now, especially during all of the restructuring that I'm doing and the lack of access to historical data that I have. So if you have specific questions, Wayne, I am more than happy to answer them if you send them over. But as far as having a comprehensive report, that's not viable at this point.
Okay, we can take a look at, I reviewed the website a couple of months ago, so that the website outlines the programs that exist right now. And then if we have specific questions, you know, how many people are participating, we can kind of ask that all together. If you guys want to funnel those questions to me specifically, that way you're not getting a million emails, and we'll just ask for these 4, you know, bullet points or whatever.
That will work.
And then eventually, when you guys are working through your plan, it'd be great if you had a segment that you could present to us then, you know, what's going on and how we can help as well.
Absolutely.
Does that sound good, Wayne?
Okay, it does, but it's not quite a report. Maybe I'll put something in writing to you and see if we can't include it in the agenda in the future.
Great. That would be awesome, Wayne, because I know you've had a lot of experience in the transportation world in particular. So, okay, do we have anything else, CORE or Aging Ahead?
Heidi was saying, I'm sorry.
No, go ahead.
Heidi last month in our meeting mentioned that about she and I getting together and getting some information and getting the information out, because a lot of people, even in the other communities I hear, are not even aware of CORE.
That is true.
Yeah, that's
some of the things that they think CORE
10 years.
does we find out that they really don't do that. So it's a whole lot of stuff. Like I had 11 phone calls about snow removal for the seniors. They don't do that. Then I had phone calls where people said that the trucks came, did the snow, and they had the area cleaned, and then the snow was back from the trucks.
Yeah.
I just pulled the limbs of who to get in touch with. I didn't know the answers.
Wow. Well, check out.
I mean, it seems like it's small things, and I guess because we rarely have the kind of weather we had. In fact, I'm stuck in North Carolina with that because of the weather. But I'm just saying, I think that was a very good idea. We hope offline we contact each other and we try to get something going with that.
Yeah,
Trying to get all the things that because it kind of really slows down the county too. It really doesn't let people know actually what the county is got going for them, representing them.
Very true.
State representatives from the different departments come and talk about what they're doing with the, I mean, I think that's always helpful because things do change.
Yeah, I think we could use an update. This commission could use an update on each department, and we might be able to provide information to them as well, especially with the newer data that we have from the seniors count people. So that sounds great. Was there somebody else? Christine, did you have your hand up?
Yeah, I was just going to mention, we don't have a lot of community locations anymore, but we're always happy to share space. So if it makes sense throughout St. Louis County for CORE to have additional sites where we operate, we're happy to explore that.
Fantastic.
Excellent.
Thank you.
That's fantastic.
There's collaboration in your lab. That's great. Great thoughts, everybody. Thank you. We will definitely talk to Dan about and look at getting those department representatives to talk to us and let us know sort of the state of their department. And we can then in turn let them know the state of seniors in the county and where some of those needs are. So those might be specific questions that we have for you.
Yeah.
Awesome. Thank you. Anything else on that? And if not, we're going to move to new business. We good? Do we need like a 7th inning stretch? Okay. So the big thing, obviously, is the committee of the whole, and several of us were there. So how did we want, you got an email, I think everybody received an email just stating that the meeting went well, that it was a packed session, lots of support, lots of speakers. I think that email originated from Bridget, I believe, right? And so how about those of you that were there, you just wanted to kind of share your thoughts on how it went and our role?
I thought it went well. In general, it was positive. The exchange with Jamie earlier, as I remember it, and I don't know if she meant to say this, but Jamie said that the budget for the Department of Health had been cut by 50%. And that's when Councilman Hancock took exception to that. And then as soon as he said, and it kind of moved right off. So I don't know if she meant to say health or whatever, but that's how I remember that exchange. And I don't know I don't know. But I mean, I guess my question is what's next steps? Because they will have to vote whether to put it on the ballot,
Well,
right? Or what's the next step?
Well, I think the next steps, from what I understand, is Jamie and the group will draft an ordinance, the language and all that. then it goes to the council and then legal looks at it and, does
Blesses
that
it.
process, yeah. And then it will have to go, Bridget, Bridget Gretchen, what's her name? She's my council person. Banger is, she's and, Archer will be the co-sponsors of
Oh,
the bill. So they will present it to the council and then it does have to be read 3 times. So
right.
I think that's a 3-week process right there, but that's my understanding is that it should be being drafted, I would think.
They don't, obviously, they know what the timeframes are to get that passed, to get it up. But
Yeah, and I know.
I think we've got plenty of time.
I think they probably do. Again, it's in Katie's hands, I'm sure she knows. what's
Right.
going on.
And the Kelly group
Yeah, it's there,
help with the,
right.
Can you hear online? Are you able to hear this conversation?
Yeah.
okay.
Okay,
Okay,
I want to make sure you're being.
So yeah, that's my understanding as well.
Yes, Kelly was, I don't know if you saw, but Kelly was at the meeting on Tuesday, so.
Well, one thing that we all anticipated, and I was thinking about this morning when I worked, was the question about the tax freeze and on the property tax freeze for older adults and on increasing services. And one thought that came across my mind, but I'm not sure if I'm right, that is going to have that it's going to be a disproportionate. So if you if your taxes are frozen and you are the higher end, then you'll still be paying a higher tax. Whereas the services that are being rendered by the senior fund is really going to be for people who are in need of those services, which is not going to be that group. So I think we need to, I got this feeling that the tax freeze on the value of your property. Dan did a great job of showing how small amount that was.
Right.
But I do think that we need to kind of really contact the council people as individuals to share that that freeze is very small. And so, and those 17 million, which is the high end of what would be garnered for senior services, is really a small amount. And the other misconception that I picked up from the county council was that we were spending large sums of money on these people.
Yeah.
And that was something that I didn't think was well enough addressed. That in most cases, I think one of the service providers did articulate that there was an individual who could no longer keep up with his house. And so they were able to find an apartment for him that was affordable and therefore he was taken care of. I think we need to hear more of those kind of stories because there's this perception that these older people who need these services, that it's long-term and ongoing versus a one and done.
Yeah, but my feeling was that the council, and it was more than one council person, was looking for something fairly specific as opposed to just an anecdotal answer to their question.
Right.
So I think what they were looking for is more like, what's the average amount spent per client? What was the other thing I just put right out of my mouth? I'm not gonna see it.
Well,
But things like that, they were looking, and they were looking for how do you,
They were interested in means testing.
right, means testing.
Very much so.
And clients, what's the means test for the clients? And on the other hand, how do you vet providers?
Yeah.
What's the process for vetting providers? That came up more than once too. And I think it came up more than once because I think they were looking for something more concrete, There were good answers and I cringed a bit, and I don't know if it was Jamie or someone said, well, it's a tight-knit community and everybody knows everybody. And that
It was
may,
Jamie.
yeah, that may be very, very true, but that's still not a vetting process,
No.
So there's a little work perhaps to be done on that. the bottom line, after the committee of the whole meeting the other day, I don't think there'll be any problem with it getting on the ballot.
No,
That's not the problem.
No.
And some of the council members, I think, alluded to this, that that's not the problem, but the problem that we or anybody concerned with this is gonna have is getting the damn thing passed. That's the problem.
well, and I think the council, I would encourage that they were engaged and they did ask questions.
Yeah.
And they were kind of pointed.
And Cookie's got her hand up again.
Okay.
I just saw it pop up.
No, it's just, but I think what that does is, it was good because it shows what people want. And
Yeah.
granted, council people are not the typical person that's going to be hearing about this, but I think just with their questions, I think that's something that can be addressed and the presentations can be tailored a little bit more. And I think with the senior tax freeze, I mean, the help was there and it's not a bad thing, but it was minimal. And it certainly
Well-
maybe wasn't the best use of funding, because there was no needs test at all. And I think in getting the senior fund initiative, the point across, it needs to be very clear and it can't change, because that's what happened with fixed rates. Is that it changed and people were confused and they don't, and I think to this day,
Mm-hmm.
most of them don't understand.
Well, I have to say the one of the things that was brought up by, and I can't remember the councilman who did it, was, are we doing a whole kitchen or are we doing grab bars?
Right.
And I really thought about Cookie when that was brought up, because I remember the story that Cookie told of a neighbor of hers or a friend who came back from being in the hospital to her home and she was on oxygen and she had a gas stove. And so because of the gas stove, she had to move to an assisted living. Well, changing that gas stove to an electric stove is a minor, it is something that would have been much more.
One-time cost.
One-time cost. And
Right.
I wish that had been kind of brought up as a response to that question from that council person, because you could see he was seeing granite countertops and we're seeing the difference between a gas stove and electric stove.
Right.
So
And I apologize for that. Due to the weather, and all intent from my heart was to be there. Southwest changed the flight. I wasn't able to be there. Because I think it was Janie, she had even asked me would I speak, but I wasn't there. I tried to find a way where I could get on some kind of, and speak from where I am to there, but I guess I might have did that too later. And I'm not that tech savvy, y'all. Y'all just already know that. I'm like all the rest of the seniors. I have a hard time too. I just wish I could have, and I wish I did get a chance to speak, because it is not all the counters and things, because a lot of this, to me, and why I'm so concerned and interested, it really comes down to their health and their quality way of their living and handling their health. Is the way I look at the picture for any of the seniors. The cuts in medicine, how they get their medicines, how often the doctor views them, how long they have to wait for surgery. I mean, the back and forth. I learned something that has it has a bearing, but it really didn't at the time. I was doing something for the Rustic Roots at verifying ages, and I was trying to do it in a way where I could get everybody's information, and I thought it would not be so difficult in certain areas and in groups. And what happened, found out most of the people were absent because they were going to dialysis, or they were going to a center, or they had doctor's appointments, or they had to wait on their caretaker to come. It was just a job made because of the connection of all this stuff. I don't even know how to put it in words. When some of the seniors call me and tell me, well, I want to do this and I like to do this, but they don't know how to do it. And they don't have people go online for them. It's just, I'm sure. And then Jamie told me that it's not only in North County, it's areas in South County the same way.
Yeah, and hopefully the pieces, the educational pieces that come out of this, that was really important when Bridget was here, when we had the presentations, and Jamie is so connected with us, but that we share these very thoughts, because that is how they can respond to that, and that's how we'll be able to address specific questions and barriers. So if there's an objection, that's something we're throwing out here to say, you're misunderstanding. This might be a one and done, $500 gas stove or electric stove. Those kinds of things that the campaign group can translate into educational pieces. So if you remember in 2016, we existed for 3 weeks when our first meeting was October 16th. And the vote that did not pass in St. Louis County was obviously early November. So we didn't have any opportunity to ask these questions or to throw these possible barriers out. And we do have that now. So is there anybody else that wants to review? They were there yesterday and want to talk about anything?
I just had a few thoughts. One, I don't know if people saw the article in today's Post-Dispatch, but the headline was providers advocate to the county council for this and for the senior levy tax. And I really think we need to, providers are really important, but a little bit because it was, most of the presenters were providers. It was a little bit, we need this money.
Yep.
And I know I've had this conversation previously with Jamie, and that is, we need to have individuals get up and speak.
Yes.
As to, I was on oxygen and had a gas stove. We need to get individuals who can share their specific experiences. Because the optics to me, because it was just kind of one executive director after another getting up. I would have liked to have seen a little bit more variety.
Well, did the article make it seem kind of self-serving, like the providers are advocating for it? So
I think a little bit. I thought the article was pretty good in outlining, this is what they're asking for and this is the way it would work. I thought that was pretty clear. At the end of the article was the gentleman from Show Me St. Louis, and I thought he didn't speak, and then it said he testified at the county council meeting that followed up and basically expressed concern about which really didn't come up, and that is, how is this going to play with the tax freeze? It did come up, but it didn't come up with specifics.
Well, and the other point that Shalonda Webb made, which I thought was important for us to know, which is what are going to be the other tax measures on the back.
Oh, I think.
Because because they're, how do we say, those are, because that came up a lot, is why is the senior population so deserving when we've got all these other groups that need it?
Yeah.
Yeah.
And do you remember when what was it, 2020, when that was when Better Together was working, and so the consultants at that time, I remember sitting at those at the meetings, the executive committee meetings for the senior levy, and they said, no, you can't put it on the ballot because this is a year where voters will check no, 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 no. And therefore, it wasn't about any specific measure. It was really voter mentality at the time was no, 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 no. So to spend $500,000 to put this on, you know, was not seen as good use of funding from the funding sources. So I think that understanding voter mentality and then doing an appeal, you know, that's like you said, this can't be a provider driven. Providers are speaking for those, like Cookie said, we're not tech savvy. Older adults are not organized in the same capacity. So the providers have to be seen not as money grabbing, but they have to be seen as representing those that can't bring themselves to that table. And that's what I think will be part of the messaging strategy.
I'll entertain other opinions, but I believe that there is a fair amount of, what is a better term, political naivete among some of these providers. I was overhearing some things after, you know, in the hallway after the meeting dispersed. It's like, oh, all we need to do is get this on the ballot. It's going to be, there's not one senior in St. Louis County that would vote against this. And I'm thinking,
Have you met the Central Corridor?
they're gonna,
They're the ones that sunk it last time.
they're gonna vote their pocketbooks the same as everybody else.
Yeah.
You know, if it doesn't directly affect them or someone they know, why am I voting for another tax? And I think that's gonna be a problem that's gonna need to be overcome. Craig, I see your hand up, go ahead.
No.
No, yes, Craig?
Yes, here we go. Thank you. I had to grab the button there. Yeah, if you'll allow me to possibly overstep and just add my opinion, I think you're right as far as trying to get people that have used this, use the services to come and speak. It sounds formulaic, but I do believe a good approach is for people to introduce themselves, try to get people from all the different council districts who have used these services, say that they love their community, you know, whatever community that is, and stress that they want to stay there and that these services have allowed them to stay there. I think there's something really big about trying to make sure you're showing that this person loves a place and is tethered there, because each of these council members, as jaded as they are, they also love these parts of their community. And so as much as you can tie it into that, into keeping people in those areas, I think it's effective. But that's just my perspective on it.
No, and as far as the voters go, it can't be seen as a North County measure or a South County measure or a New City measure or whatever. It has to be seen as benefiting all the seniors across.
Absolutely.
Mm-hmm.
In addition, the other thing that kept on coming up was jobs and the young people who need to move in. And I think the other part that I know, when I was working in the Grove area, there was this conflict or challenge between new people coming in and building new houses and raising property values, and then the rock solid older people who had been in the community forever, seeing their taxes going up. And one of the arguments that you were told a lot by the community leaders there was how critical those older people were to the strength of the community. So getting back to what Craig said, I think the other piece of information that would be really helpful is how much the older residents volunteer in the community and volunteer in the schools and volunteer with transportation and so on and so forth. Because that was the other view, is that this is not this isn't all need and no contribution.
Yes. I think that's a perception of older adults. You're right. And that's something that hopefully those putting together the materials and the educational pieces for this levy will say we serve a role and we also have needs. It's not or, it's and that's a really tough sell. But as you can see, every one of you sitting around this table are providing something to this community, and whether or not you eventually need a ride someday doesn't negate what you provide. So you can need services and also provide and be an asset to your community. And I think that's really important. And that that's a bigger picture. That's the respect. That's, you know, our anti-aging efforts in America. The how much, you know, we allow just ageism to creep into our language, to creep into so much. Ageism is acceptable. No other ism is tolerated like ageism. And what's that? So anybody else have anything on this that they wanted to add?
I just have one other thing and then I'll be quiet, but,
No, this is our big session.
well, I came away with, the county council could benefit from knowing more about aging services as they exist in the county. Because I don't think there's a depth of understanding, and as a commission, I think we can play a role in that, possibly at the, at our committee presentation, just to talk more specifically about, you know, maybe talk about CORE. I mean, they fund CORE. You know,
They do.
and other services that touch seniors as well, but CORE is that hub, and I felt there really was not the depth of understanding of what CORE does. And also aging ahead. And I mean, aging ahead is, you know, a big provider in a region, and I think they could benefit from that as well. So that's my 2 cents worth, but I think we can play a part in that as we talk about both what services are provided, but what services have waiting lists and an increased need in the county.
Well, hopefully, any of the council people, one thing we should have taken away from that the other day is the percentage of seniors in St. Louis County.
Yes.
Thank you so much.
They want to keep their jobs, no offense, Greg, but if they want to keep their jobs, they need to be attuned to the needs of that increasing senior population. And if it is a truism that seniors are the ones who vote, it doubly behooves them to be aware of what's out there for that increasing population that may or may not vote for.
And kind of going back to the same thing as before, is that I do think it might be beneficial for each one of us to contact, if you have a connection to that council person. And correct, I did specifically ask Lisa to, if there was, are there questions that the council people have, and can we, because the bigger point that I keep wanting to make sure they recognize is the huge contribution of that aging population to the community economically, and in every, that they, that, as I call it, the 65 to 70 to 85, there are a lot of those people who are very, very productive and contributed in an enormous way to the community. So,
That's our volunteer base.
Mhm.
yeah,
That is the one, probably 99% of our volunteer base.
you know what, that is exactly what the information we need.
Because they have time.
Yeah, because they have time and they want.
Commitment,
Yeah,
commitment to
That's
your
a great,
community.
yeah, so that's a great question. When Wayne was asking for specific questions, you know, your volunteer base, that's a huge fact. If you could tell us how many, you know, how many volunteers are
Yeah.
60 plus.
Liz, I love your idea though. I mean, I think it would be good for all of us to just send a note and say, thank you for being there. Thank you for your question. Is there anything else that we can gather information for you and get back?
You know, there were a couple of things, which listening to you guys and not interrupting, because I'll forget. You know, I was doing these things when Aging Ahead, when Lisa Knoll was there, and I would take inserts from different of their things that they shared out, and came across one that you could dial this 800 number and get in touch with Aging Ahead, and I'm glad Aging Ahead is on the line. What happened is, found out that a few of the seniors had not updated their phones. So a 1-800 number or calling to Aging Ahead was a fee, and no one was aware of that. Literally, there were a couple people who had to go straighten out their phone bill to get in touch with Aging Ahead. I don't know how many seniors that affected, but that actually happened. I was putting stuff out that about Aging Ahead, the events and the transportation information, and ran across that the seniors were trying to get to them and could not because of a 800 number or the phone or something that had not been updated. There was a fee for them to call, and of course they weren't doing that.
Yeah, that's
Uh,
fortunate that happened.
there's I to this day, because I don't go back, I don't know if that has been straightened out or not. I don't know what other 800 numbers that may or may not affect.
I don't know.
But that was something that actually occurred where they couldn't reach to Aging Ahead.
I think there's
And,
two.
I am trying to put together, because when we were talking with Jamie about educating the seniors, last year I did what we call a senior day. It was short and brief, and I didn't have a lot of time. I just wanted to get the seniors out and together, and it was in October. So this year I got it planned. The only day that I could get was June 20th out at the Spanish Lake Park. And I'm hoping all of the commissioners and all of the people involved with the seniors come together and we could educate them and talk to them, because it's not, as I say, it's not just Spanish Lake. It's open for the seniors in North County to participate and come, looking for the vendors that only focus on seniors. Hopefully nobody charges. In fact, that's what I ask. When they come, they don't charge these seniors any money, and just talk with them individually. I wish I sent out email, but something also now is happening with my emails. I'm just telling y'all, I'm just having so many things. Where on June 20th, I think I have it set from 10 to 1. And so we can educate some of these people, the leaders, the people who are part, all of them, as many as we can get. Because I don't have a building and I don't have all that fancy. So the park was my next place that I could do this.
Cookie, that's great. We really appreciate that. And if you could, when you have that put together, if you could send something out to everyone that those that are in town or are available could attend, that would be great. I think that ties us back into the issue with that just at the CAL meeting, and that's the communication and sharing of information and resources. So
she heavy. I mean, I think she willing to help with all. I'm sorry, put on the line here, but her participation. Liz said she enjoyed it last year, and it was put together really fast. But if we could bring all these seniors out, and you're talking about the individual stories, I don't think you wouldn't be missing any, because you would directly talk to them. If we could get the county councils to come and all of us and just talk to these people, talk to the seniors. I need to be educated some more too, but it's a gathering place, it's a start, it's opening, and then they won't be misguided, tricked, or don't understand, because they'll get it from you guys. They'll get it from the county councils. Half of them probably don't even know they have a representative of county council. Y'all just, I just can't really begin. I don't want to drain it out with negativism, but education would really be something to explain to them, to talk about this. And I think you would get your voters.
Thank you, Cookie. We're gonna have to move on, but that, all of that is duly noted, and I think we'll tie that, I mean, that definitely ties in with the whole educational piece and what the senior tax levy is about. So you continue advocating the way you're doing, and, you know, CORE is looking for creative ways to collaborate. Aging Ahead is looking for ways. So I think this will be a big push towards collaboration. And it won't happen overnight, but that's what we're trying to do here. That's why we're all volunteering here, are for those same reasons. So does anybody have anything else on the new business number 1 update on?
I'd like to ask Craig if there was anything that Lisa, particularly anything that she had to say after the meeting yesterday about.
No, that's a good question. It was actually a crazy day. We had 4 meetings, and so I haven't totally debriefed with her on that one. I know that some of the important stuff will be, you know, what she and the other council members discuss behind the scenes on it. But I think it seems as though this has wide support to put it on the ballot, but don't quote me on that, because as soon as you quote me on it, I end up being wrong on things. But that's sort of my take on it.
And did she express what the challenges were to get it passed after it gets on the ballot?
A little bit. Part of this though is the council's role will not be getting it passed, and so it becomes a thing where you have to really firewall this off. There'll be plenty of agencies and groups that'll work to pass it, but it's we have to be very careful that the county is not advocating for a position one way or the other on it. We can get in trouble on that kind of thing.
That's why we have legal here.
Exactly. So I can tell you that she personally supports it. You know, what that would look like on a campaign trail, I wouldn't think to try and speculate on.
Okay. Anybody else, or else we're gonna wrap this up. New business number 1. On new business number 2, closed session. I know we had an email about that, the need to have it or not, and I had recommended we not have it on the agenda because Dan was not here. And so we don't seem to have anything currently that I'm aware of that needs a closed session. Is there anybody who thinks differently that we need to vote for a closed session? Okay, then we will table number 2. I believe it was put on the agenda just in case we needed something. I think that was the advice we were given. So that's great, but at this point, we are good on that. So I think we're ready to move on. Senior fund really tied into, so agenda item number 5, the senior fund. I don't know, is there anything else? We've kind of tied that all together because committee of the whole was solely focused on senior fund. So if there's nothing else that anybody has to add, then let's jump to number 6, committee on disabilities. Is Sue still there?
Yes, sir.
Okay, your hand's up.
She's on
Places
twice.
at once, so
Everywhere.
that's right.
Can you hear us, Sue?
Don't think we can hear her.
I just noticed that this is a new system anyhow. First of all, I want to thank you for doing this virtually. It's really been a big help to me. Number 2, I know we talked a lot about transportation, and our family has come to a situation where our daughter is not easy to manage on steps. So we were reaching out for some sort of a transportation program, and but she has Medicaid, She's entitled to the medical transportation network. And they come to the door, pick her up, and a parent or family member can go with her and take her to her appointments. And they come back and pick her up and bring her back to the front door. And there's no charge. And she can do that because she is on Medicaid. And I'm thinking that maybe a lot of seniors are also on that Medicare, Medicaid network, and they might want to try that. The other thing, and this is two things that the Commission on Disabilities was working on. We're very concerned about people parking in handicapped parking spots that really don't belong there. And so we have talked to some people about how we could enforce that, whether we do a PSA with the county police or how we do that. And one thing is that the Governor's Council on Disabilities already has a item on their website that talks about it, but there's also a bill in the state legislature to increase the funding from 100 to 300 and 500. I don't know what the status is at the moment, but there is a movement to increase that violation fee. Number three is that, and maybe this doesn't concern a lot of people because they don't ride motorcycles, but the helmet law that was overturned several years ago, now there is a action in the state legislature to bring it back to where it was before. So those are my things. If anybody has any questions about either of those, they can give me a call or send me an email. Thank you.
Thank you, Sue. That's your story. I'm thrilled that your daughter has services. And that's something that, of course, my brain starts turning like, who do we know that's not taking advantage of that? And that would be a great way to get that message out as well. So thanks for sharing that very personal story. We have come to item number 7, which is commission member share out. And I'm thrilled that Cookie took the lead on that. And that's awesome that she's developing for Seniors Day. Anybody else have anything exciting? Or not exciting? It doesn't have to be exciting, it just has to be related.
Yesterday, both Helen and Deborah came. I had sent them a note because I thought, these are commissioners, they are well aware of this. And so I was thrilled at that. And upon leaving, they said, oh, I would love to get together. So that would be totally non-commission activity. Just want to make that clear, but maybe in the spring, we could all have a lunch or something.
Yeah.
Get together.
That's what with some of our former commissioners. That would be exciting. A lot has changed, a lot has stayed the same. I was thinking about when I went through literature for last month's meeting when we were trying to find original ordinances, and Susan had been instrumental in every time I had some request, it's like, well, then became Susan's problem. And so, and she produced, but we've been through, it was under Charles Dooley that the age-friendly initiative started. And so, there've been commissioners and council people come and go, and the commission has sort of stayed the course. We have our 4 focus areas. So we have a template, and you're watching this template. The most solid data we have is from 2016. And so unfortunately, that's when there was just a lot of attention given to seniors. At that time, the administration supported that. And so we saw what was happening, this rise. And now 10 years later, that data, it was accurate. When they were projecting the number of seniors in St. Louis County, it was pretty spot on. So because seniors aren't moving out, and for the most part, and so that's what you're seeing is this rise, but we haven't seen the funding match, and we haven't seen any parallel programming growing. So that would be a graphic I'd love to see. Here's where we are. Here's our projected growth of the, because originally for seniors, for the age-friendly initiative was 45 plus. and it was 3 separate groups. So when you watch that group aging and the service is not keeping up, the gap just grows and grows. So that's why it'd be really nice to see the parallel the services, what's going on in the county. If you've got, you're projecting this growth of seniors and yet you've flatlined services or cut services, the gap is just getting so significant. And this senior fund is addressing that specific gap. So, but I just, as I was going through things, I was, this is signed by Charles Dooley.
You know, Lisa, kind of keeping with that, I think it would be also interesting to see COVID, the effect of COVID, because we know that as a commission, we were able to get $1 million given to the library to provide the technology for the seniors. And we know that that had a tremendous positive effect on telemedicine and on that transition from Brooks and Mortar going to see the doctors to this other form or other method of providing services and care. And that would also be interesting, is that how much did that transition then, caused by the pandemic, and what was the effect? I wanted to ask Christine, because she said that the library had a separate study about the grandparents with them. So I'll reach out to Kristen Sword and find out if they have any data on what they did.
Because that could possibly be the single most important, I don't want to say the single most important event, but that was the single, a very important piece of addressing an older adult need during the pandemic. And it was so very specific, and the framework was there, and the implementation team was there through the library. Liz, your communication efforts and your relationship. I mean, there were so many pieces that made that come together, but I'd say it was one of the single most important things that occurred during the pandemic for seniors.
And I think Aging Ahead was so responsive, and then they were able to take it over and turn it into the virtual. That was a great story of how things were.
That
was a
collaboration.
Fabulous partnership.
It's the
between those
collaboration.
two.
Yeah.
It's wonderful.
Yeah.
But there were stories, the personal stories that Kristen shared with us about people who were leaving messages on the phone line. This is the best thing that's happened to me. I mean, it was just, those were the messages.
An isolated senior.
Yeah.
Likely had some contact with
Touched her heart.
So, yeah, that was pretty impactful. Does anybody have any item number 8, additional comments on items discussed in the meeting?
I guess my only, we wanted to follow up with our county council members. I will reach out to my county council person with a note, and I just, it's just a nice gesture. And they may have walked away and gone, oh, wish I would have asked this.
Yeah.
And I know Jamie would be very receptive to get us answers. And then again, it just may go to their inbox, but still,
It's awareness. Yeah, it's an awareness piece. And if we do that staggered throughout the year, it will keep it top of mind. And hopefully those anecdotal stories can be little snippets, one paragraph, like one of Cookie's stories, one paragraph that we can send to let a council person know of a story of success or where a simple need, we should call that our electric stove initiative. Okay, hearing anybody online?
Sharon?
Ricky, anybody have anything, additional comments on anything discussed in the meeting before we adjourn? Hearing none, next meeting is set as a virtual meeting on March 5th at 9 a.m. And that information, that link will be sent out before, with any luck, it will be sent out several times or not at all, depending on technology. But we'll make sure that you get that link.
And I'm not
I'm not 100% sure that that's correct, because I didn't get a chance to talk to Dan. We might still be doing hybrid, but there will be virtual,
Okay.
one way or the other.
Okay. Yes, so, hearing no other comments, do we have a motion to adjourn?
Second.
All in favor?
I.
All opposed? Meeting is adjourned. Thank you all. Appreciate it.
Good luck getting home, Cookie.
Yes.
Sorry, I didn't,
Safe travel.